Thank you so much. That was a really sweet introduction. Thank you guys so much for joining me here and, you know, wanting to learn more about birds and specifically avian nutrition. I'm really excited to talk with you about this. And, you know, you think about avian nutrition and you go, oh, that's a big topic, right? And we look at this and we say, well, how can we will this down to information that's totally relevant to y'all in clinical practice um, in an hour, right? So, what I did is I developed this talk to kind of cover just, well, we'll go to the next slide and we'll talk about that, right? So, here's the situation. Avian nutrition as a topic is super, super diverse. There are all of these different areas of avian nutrition. When you look at, where do we get our base data from? How is the diet formulated? How is it produced? How do you further analyze it? Now that you have this diet, what's the best way to feed it? Do those recommendations work? That's what feeding trials tells us. And then it comes down to us, right, in clinical practice and us as bird owners. How is the bird used, or excuse me, how is the diet used by the general public? And then how do we as veterinarians use it you know, therapeutically? So what I'm going to do is present to you all like a couple of cases that are going to talk about and cover just, point 7 and 8. How can we guide the use of diet to improve our birds' health and their birds' health um, in the clinical setting? And then how can we use diet therapeutically, right? So, all right, here we go. Welcome to Harrison's Bird Hospital. All right, it's your first day, or maybe it's your 10th day, who knows? But you work at Harrison's Bird Hospital and you have back to back appointments all day. They're all scheduled as wellness appointments, but you're ready to expect anything. And whether you know this yet or not, a wellness appointment in practice is never a wellness appointment. It's very, very rare that you're actually seeing a truly healthy individual. So it's important that even though it says wellness, that you are ready for anything. All right, so your first patient is Momo. Momo is a 3-year-old Congo African gray. He's a DNA male, and this is your 9 a.m. wellness appointment, okay? Here's what we know about Momo. He was rescued 2 weeks ago by brand new bird owners. They're telling you, we've always wanted a bird, and we saw him on Craigslist, and he was just so sweet, and his story was so sad. So we said, hey, we'll take him, right? We'll take care of him. So they have the best of intentions, but they have no experience. They don't know anything about his medical history. They don't think he has any, but they do know that he had a DNA test to know he was male. You're in the exam room and he steps up really good and he's a sweet bird and he's vocalizing. He's not showing any type of fearful behaviors or escape and avoidance behaviors. So this is a really exciting moment because you have bird lovers who got their first bird. You get to teach them how to do things right. And, so far, behaviorally and physically, he's doing pretty good. So the next thing you do is you go, well, I don't know anything about his diet history. So we're going to get that diet history next. How do we take a diet history? It can get really complicated. There's all these different forms and things like that that people have created to try and guide how to get as thorough of a history as possible because the details do matter. What I've done is I've figured out, well, what are the top 4 things that I need to know that affect my decision making the most? And this is what I ask my people, my owners. What do you give your bird to eat daily and in what quantity? So I want to know everything. And I keep it an open-ended question. And I try to control any type of, expression on my face because we have to remember that these individuals and most individuals are trying to do their best and they may not know what is right. And I don't want to ask yes or no questions because I want to hear all the things that they have to say. So ultimately, know what you want to know what they give them and how much, right? From what they're given, what do they actually consume? So many times in practice, I've had people describe what I consider to be a beautiful diet, but then the bird's only eating like, you know, the treat part of the diet, right? And you're like, oh, that's not good. We need to adjust this. The other thing that I like to hear is, oh, yeah, we give him pellets, doc. Okay, cool. Well, does he eat them? Oh, no, no, no. He only eats the seed in the bowl next to the pellets. And you go, oh, okay, that's important, right? So it's important to ask how often they change the food or water. With dogs and cats, it seems like a natural understanding that people have where they just give them clean water on a regular basis. For whatever reason with birds, if the water bowl isn't empty, people will not clean it. And we know that birds dip their food in the water. We know that they're preening and feathers fall in the water. Maybe there's a piece of a toy that falls in there. So it's really important that we counsel our owners and we teach them, hey, you got to make sure they have clean water all the time. Same with the food. And we're going to get into that in a second. And then it's important to ask this question. Does your bird forage for its food? Now, most people are going to say, well, what's that? And really, that's the point, right? I want to open up. I want them to wonder what foraging is. I want to open up that conversation with these clients because ultimately it's going to be something that we talk about that will aid in the enrichment that they offer their bird on a daily basis. So, this is what we learn about Momo's diet history, okay? They went to the feed store and they got bird food. Nothing more specific than that. They go, I got the bag that said bird food on it. And they just give him as much as he wants. They fill the bowl up and that's it. In that bird food, he likes to eat the peanuts and the little white seeds. In fact, the little white seeds are his favorite. And then when the water gets low, it's changed, but it's not changed every day. And the food is changed every 3 to 4 days. And they go, you know what? It kind of stays full. We see him in there, but we don't know. Maybe he's just not eating that much. And they have no idea what foraging is, which is okay because that's part of what we're going to teach them. So I hope already you notice that, I hope already that you notice some of the issues that are present here, right? So let's go on to figuring out what recommendations we're going to provide for Momo. Here we go. And well, here's the thing, right? Today, his visit is going to focus on nutrition. I think we can all agree on that. So one thing that we have to focus on here is that he was originally on a seed-based diet. And seed-based diets are not good. And we know they're not good, but why, right? First of all, a lot of the micro and macronutrients that are necessary in a diet are deficient. And you can see all of these things here. And then you have proteins, fats, phosphorus, omega-6 fatty acids. These are all in excess. So when you have this imbalance, you're not going to be able to maintain the health level that you need to. Well, the other thing that's important is that the protein quality is not super great from seeds either. So you're getting some, but it's not awesome. Depending on where the seed is grown, you can have deficiencies. And specifically, this affects budgies, where you get iodine deficiency and they get goiters. So, you look at this and you say, hey, we can't have seed as the only thing this kid's eating because he's not going to do well later in the game. So here's a fun little thing. I'm going to open up the chat and take a look. Now, there are certain seeds that you should know what they are when you're in practice, okay? So who thinks, like, if we're picking from the circles and the pictures at the bottom, which letter applies to millet? D. Okay. All right, that one was easy. Okay, perfect. And what about safflower? What letter applies to that? Yeah, okay, we know our seeds. What's going on? Okay, what about buckwheat? Yeah, okay, well, I guess that even if you didn't know buckwheat, if you knew sunflower, that was kind of like a one of exclusion. So beautiful. You guys are doing great with this. These are things that I had to learn and when I was an internship. And so ultimately, y'all got it right. Beautiful job with that. And so the little white seeds, that's Momo's favorite. These are the safflower seeds. And this is really important for some of the things we're going to talk about with him later. So first of all, we want to fix Momo's base diet. We want to get him on at least 75 to 80% formulated pellets, okay? This can be formulated pellets, this could be nuggets, but some sort of formulated diet. I know I work for Harrison's. I believe in them wholeheartedly. I think their product is excellent. But when it comes to getting a bird on a balanced diet, any of the truly balanced diets that are out there in the market, whatever they will eat is better than seed. If you can get them on Harrison's, even better, because the organic formulation and all of those things that the diet brings to the table just enhances the nutrition that they're going to get. But it's important that you get them on that formulated diet, okay? And then that's the majority of what they're eating in the day. 15 to 20% should be veggies, a little room for fruit in there, but not too much. And then 5% can be left for seeds, nuts, and some of those higher fatty type food items. Now, if you didn't want to do seeds at all, that would be okay. But the way I use seeds, nuts, or any other high calorie or high value treat is that's what I leave to the side for training and for foraging. So they have to work for that 5%, okay? It's like, hey, you get a donut, but you have to run half a mile to go get it, right? You feel better after you run, and then you get a donut. I mean, my gosh, that's a wonderful pairing, right? So the other thing is the proportions of food is important, but the volume itself is important as well. I know that classically people care for their birds by putting a whole bunch of food in the bowl and leaving it until it gets kind of empty. That's not ideal. And even with the best formulated diets, birds can become obese on that type of feeding schedule. So it's important to counsel owners that they should be measuring their birds' pellets and measuring their birds' food on a daily basis, okay? And offering two distinct meals. So this is what I will say. I'll say in the morning when you wake up, measure out, in this case for Momo, a tablespoon and a half of his pellets, put that in his bowl and offer him a little bit of veggies. If he runs through the whole thing, you can offer him a little bit more veggies. And then in the evening, you can do that again, same kind of meal. And it's really, really powerful. And you would be surprised that these birds maintain an excellent body condition and behaviorally, they're way more balanced. And this would be for a bird who is not breeding or anything like that. And most of the time, you're going to encounter birds who are not breeding birds in private practice. So this type of conversation is so important every time you see any type of wellness patient, because you're going to avoid a multitude of problems if you can set the foundation up right. So I want to know who thinks that that this bowl here is full of actual food that can be eaten. I love this. Oh my God, I love this so much. You guys are so on it. This is amazing. Okay, so you're absolutely right. What is actually in this bowl is a whole bunch of husked millet. So you will be absolutely surprised at how many times a small cockatiel or any type of bird comes into the clinic in a travel cage. And that travel cage is their everyday cage, which is a whole nother thing, right? But we're not going to talk about that on Nutrition Day. And their bowl is full of husks. And you talk to the owner and you ask them, how often do you change the food? And they say, oh, well, it's full. And you have to teach them that the seed is different than the husk, and the husk will be left over. I've had birds come in travel cages like this, and they have been absolutely starving. And the owner goes, I don't understand why they're not feeling well. And you look in the cage and you look at the bird and you go grab some millet from the back, and the bird just goes wild. And they have no idea that they are accidentally starving their animals. So this is really, really important to notice. And I think you guys all know this, but you've got your seed. It's the inside part here that ultimately they eat, and then they leave the outside shell or the husk. And this goes for every single type of seed. Okay, so We talked about what the base diet, what improvements we want for the base diet. We've identified what these little white seeds are. We also have reviewed that we want to change the water and change the food every day with measured things. And okay, what about foraging, right? So here's the game plan. Momo's diet recommendations. Transition to a formulated nugget or pelleted diet. Eliminate seeds and nuts as a base diet. Measure food and feed in meals twice a day. Introduce veggies. Clean and replenish water daily. And use safflower seeds for foraging introduction and training. Now, I want to know, does anybody know what disease African grays will get as they age if they're on a high fat diet? Oh, okay. Yes. Heart disease, fatty liver. Yep. Atherosclerosis. Beautiful. Female birds on that are persistently laying eggs that have a high fat diet. And if you're an African gray, cockatiel, you're at high risk for these things. Oh my God, I love that you guys all know this. This is huge. This is like absolutely amazing. So that's also something that you can talk to this client about. Hey, this is really important. I know it's going to be a little bit of work at home, but ultimately, this is what you're going to be able to prevent later on in the game. So really fabulous. Um, all right. So let's talk about diet conversion a little bit, okay? Now, diet conversion is something that you only want to do if your patient is generally stable, otherwise healthy, okay? You don't want to do this for a sick bird. There are very few circumstances where changing the diet when they're really sick and moderately unstable is going to fix them. It may be a part of their overall therapy, but you have to make the timing of it right because it is inherently a stressful thing. And our goal with diet conversion is to teach an animal essentially that something that they see that they don't associate as food is in fact food. So, how do we do this? There's a lot of different methods, and the method that is most successful really depends upon the bird's behavior and the bond between the bird and the human. So, as you can see in this video, this is referred to as the hunt and peck. This is like really successful with ground foraging birds. So, cockatiels really like this. And you use your finger to kind of bring attention to the different food items, and you have different types of pellets spread out all over the table. And they come in and you kind of show them a little bit, and then they look at it a little bit. And ultimately, it's one of these situations where they start to pick it up, put it in their mouth, chew it a little bit. Ooh, that's good. And you introduce, hey, this is now a food item, right? Once they start to show interest in it, you can introduce it into the cage. And ultimately, if you're there during the day, you can watch to see if they eat. You can just give them the pellet as their only food item and monitor to see that they eat. Or you can have a small amount of their old diet and a larger amount of their new diet and kind of slowly transition that way. Some people don't do the interactive thing, they just slowly diminish the old diet. And what I find is very successful, especially with birds that have a good bond with their owner, is mirroring. So just like any 3-year-old, right? Look at how cool it is what I have over here, right? I have something you can't have. This is so good. Would you like a taste? Oh, no, you don't want it? Okay, that's okay. I'm going to take it now, right? So ultimately, mirroring, look, I can eat this. This is a good thing. Would you like some? This is super successful. When I introduce new types of veggies to my own bird, I mirror and she, boom, eats it right away. And so these are some strategies that aren't necessarily mutually exclusive. You can do a little bit of them together, and birds are going to convert on their own time. So sometimes you have circumstances where they're going to convert very quickly. Other times they will take weeks, 2, 3 weeks. And for cases that the owners are nervous, but they want to do it, when I worked at Medical Center for Birds and what I have my resident do at her practice is we have birdie boot camp. We have diet conversion camp where we keep the birds in the hospital and we watch them in hospital while they convert. From there, they're able to do so in a faster manner, but also in a way that allows them to be closely monitored and whatnot. So diet conversion can be like a whole conversation in and of itself, but there are some great different resources out there that I will send after our little talk here, and you guys can review this more. And maybe our next talk can be on diet conversion alone. So let's go on to our next case. This is Boomer. Um, Boomer is a 10-year-old presumed male cockatiel, and he's your next appointment, all right? So I want you all to take a look at these pictures of Boomer. And this is a real case my resident and I saw back in January. And in the chat, I'd love for you guys to tell me what some of the things that you're seeing, in these pictures. What are some of the things that you're seeing that are abnormal? Yes, pup feathers. I loved it. What else? Yes, the beak. Abnormal beak. Love it, love it, love it. Very, very good. Closed eyes, depressed. Yes. You guys are picking up on all the great things. How about the color of the feathers? Yeah, faded color. Anything else? Does anybody think that this bird looks a little bit more yellow than it should? Maybe. Are you seeing it now? This cockatiel is supposed to be white, gray, and yellow at the top. So all of these feathers that are on the wings here that have this yellow, yeah, you see it now. Yeah. This isn't a filter. This is real. This is what this bird looked like when it came in. Yeah. So we talked about mentation. The bird is fluffed, dull. Pectoral muscle mass, I will tell you, since you can't tell, was adequate. This bird had a little bit more fat and a lipoma under its wing, which we're going to see in the next picture that I show you. Feather quality is dull, keratin quality is poor, beautiful. Since we can't do a physical, I'm going to tell you that the coelomic palpation was slightly abnormal, where it was slightly distended. This bird's respiration at rest was labored. And you go, that's weird, because you listen and there wasn't anything abnormal that you could hear. But he was huffing and puffing, more effort. So his respiratory effort was increased. Rate was slightly increased. No tail bob or anything like that. Heart sounded okay, and he weighed 120 grams, okay? So we said, dude, this is not a wellness appointment. Your color's all off. You're not feeling great. You're breathing harder than you should. Let's take some x-rays, okay? So here's the x-rays that we take. And we've got our VD and we've got our lateral projections. And I'm going to give you guys a moment to just take a look at some of this stuff. And as you're looking in the chat, if you guys want to just type some of the things that you're seeing. It doesn't have to be like a perfect, yeah, perfect. This is it. Lipoma under the left wing. So yeah, the lungs look, yep. Okay, great. Yep, I love it. What do you guys think about the liver? Anybody have any opinions about the liver? Yeah, liver's big. Yes, I love it. Mm-hmm. Um, what about the limbs? Anybody see anything on the lateral? Yeah, fracture. Yes. So there is a tibiotarsal, mid-diaphyseal tibiotarsal fracture here. So, okay, beautiful. You guys are seeing all the right stuff. So let's interpret this film together. So first and foremost, we have this fatty mass. So the soft tissue opacity on the left lateral aspect of the body wall. We can see that the opacity is different than the muscle. And so we know that this is going to be some sort of soft tissue. On our physical exam, you could see that it was had a big, thick yellow appearance to it. And so we can presume that there is a lipoma under the left wing. The liver is enlarged, so we can see the hepatic silhouette here on the VD. And then we can also see the radiodense or the mineral opaque stones in the ventriculus, okay? And these are mineral opaque. We don't have to worry about them being necessarily like mineral foreign bodies or anything like that. The other thing that I want you guys to notice is that our air sac space is really, really limited on this VD. So our caudal thoracic air sac space is just really, it's a bummer over here, okay? On the lateral, oh, my little pen made that mark, but that's okay, we can still see. So on the lateral, you can see that the pectoral muscle, that soft tissue opacity extends to the blade of the keel, which is really good. So we know that this bird has good muscle mass. And just as y'all said, what is going on in this coelom? There is no space at all. We have no air sacs visibility at all. So there is pretty significant respiratory compromise in this bird based on whatever's going on in the coelom. Now, we talked about the lungs, and the lungs are challenging. I like that you guys picked up on the fact that the lungs looked different, but I'm going to tell you why. It's not because of primary pulmonary disease. In this radiograph, we have superimposition over the lungs. Remember, we have this fatty mass on the left lateral aspect. And when we have this bird on the lateral projection, that fat is going to be overlaying the normal pulmonary tissue, and ultimately it's going to make it look more soft tissue opaque. So be careful to think about what tissues are going to be superimposed in that axillary thoracic region when you're looking at the lung tissue. Now, what could be going on in the coelom? A variety of things, right? But, and then we've got our old fracture here. Now this is like kind of old, like maybe it's starting to bridge, but this bird's leg was like pretty recently fractured, okay? Probably in the last month or so. Oh, I have another question for y'all. What do you think about the bone density in this bird? Okay, are we able to see the cortices of the vertebrae? No. Yes. Okay, perfect, perfect, perfect. I love it. It's reduced. Now in birds, we do not have an objective measure to determine bone density, but when you should be seeing the cortices of the vertebrae and you don't, and you should be seeing ribs and you don't, it's reasonable to make a subjective interpretation of osteopenia or decreased bone density, okay? So moving on, here is our list. And I'm going to tell you that Boomer's on a seed-based diet, okay? So we have significant obesity. 120 grams is very big for a bird, for a cockatiel. Also, oh, let me go back here. Okay, very, very big for a cockatiel. The other thing that I want you guys to notice is that there is a soft tissue opacity over the dorsal aspect of the, well, just over the dorsum, right? And then over the tail. That's fat. So if you're looking for fat in a bird, you want to look at the lateral flanks on the VD, and you want to look at the dorsal aspect, I guess technically the dorsum, right, of the bird on the lateral. So this kid's chubby. So here's what we know. He's significantly obese. He's quiet and fluffed. There's increased respiratory effort, decreased respiratory capacity, mild coelomic distension, a wide base stance, a large soft tissue mass over the left flank, yellow coloration of the gray-white feathers, hepatomegaly, poor keratin quality, seed-based diet, and then subjective osteopenia. And so from this, what are our top differentials? What do you think is causing this bird? Yes, liver disease, fatty liver. Yes, 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 yes. Okay, beautiful. Calcium deficiency. I love it. I love it. Okay, you guys are going on absolutely on the right path here. So our working diagnosis, severe obesity with secondary respiratory compromise and hepatic lipidosis. So what happens with these birds is that they will get so fat that they will ultimately put that fat, it's just not on the outside, it's on the inside too. And that inside fat, where does it go? It goes in the places where the air sacs are supposed to be because it's where the least resistance is. And they essentially suffocate from the inside from all of the fat. So when you have a bird in respiratory distress come in, one of your differentials has to be severe obesity because there are so many birds that will have this problem, from budgies to Amazons to cockatiels across the board, even chickens and ducks across the board. Any bird and many birds will present this way. Okay. So I want to know, who thinks we need any additional diagnostics? And if so, what could they be? And you can put that in CBC Chem. Okay, okay. Yeah, yeah. Very reasonable, right? Because that can help us get down to maybe supporting our working diagnosis a little bit more. But let's talk about hepatic lipidosis a little bit, right? So, what is the most likely story that this bird has? It's on a free choice seed based diet for a long period of time. It's significantly overweight. That fat has been deposited into the coelom and into the liver. Over time, that liver has changed in function, and now we have a picture of hepatic lipidosis. Hepatic lipidosis affects the coagulation pathway, which can lead to keratin abnormalities and bruising. We know that the increased adipose within the liver results in enlargement of the organ, but also fragility. So there is a syndrome in chickens called fatty liver hemorrhagic syndrome. And what happens in these chickens is they will be eating mealworms all year, eating scratch all year, both things that they shouldn't be eating regularly. They pack on an extra pound or two. Now it gets hot, it's summertime. They're running around in the field and they drop dead. And what has happened? Their liver fractured and they bled out. And this is a very, very common thing to have during the summer, especially in the hot, like those hot regions. And oh my gosh, doc, my chicken just came in and it's dead. What happened? Can you do a necropsy? And you open it up and there's a big blood clot right on the liver, and the liver looks all mottled, and you touch it and it just breaks apart, right? So the fragility of the liver is significant. Feather color change secondary to abnormal hepatic metabolization. So feather color, and could be a whole nother conversation, right? But feather color comes from two things. It either comes from liver metabolization or it's structural. The red and the yellow coloration to the feather is all from the liver, okay? Blues, whites, blacks, that's structural. So whenever you see a yellow change, that means that there's something going on with the liver. And then you go, okay, well, you would see bile acids plus or minus, elevations in bile acids plus or minus cholesterol. And ultimately, these are the things that hepatic lipidosis will result in. So going back to the original question, here we go. Do you guys still want to pull blood on this bird? Has anybody changed their mind? Yeah. Excellent. Okay, good. Good, good, good. I love this. Okay. So since we have enough of a clinical picture, enough of a working diagnosis based on our physical exam and x-rays, blood work is likely not going to change our plan in this case. And because of the liver abnormalities that we presume are there could be an increased risk to that venipuncture event where they could not clot appropriately, clot slower. And also, trying to pull blood on a chubby bird is very difficult. It's hard to see those vessels. So again, it's important to say, what could we do? And then what should we do for this patient, right? It's very, very rare that I will pull blood on chubby birds. I will help them lose weight first. And then once I think that it's safe enough, a couple months down the road, maybe I'll check and see kind of what's going on under the hood. So excellent, excellent thought process adjustment there. So what's our game plan for Boomer? We're going to change his base diet. The priority for this specific bird is weight loss. So let's take Harrison's diets, for instance, right? There's two types. There's high potency, and then there's maintenance. Normally, when we're transitioning a bird to off a seed diet to a pelleted diet or a nuggeted diet, we want to use the high potency, right? But in this case, I know this bird, like we can all agree that this bird has some type of vitamin mineral deficiencies, right? But our priority is weight loss. We have to get this bird breathing better. And if we don't do weight loss first, he's going to get worse and he's going to go into respiratory distress. So we want to use a maintenance-based diet, at least initially. And this is where diet comes in as a therapy, right? Measure out the food, veggies ad lib, right? So he can have as many veggies as he wants, but we want to make sure that we measure out his pellets and get him on a maintenance pellet. Close monitoring of his weight, so getting the owner to keep a weight log daily at home, and rechecks once a month to make sure he's not losing weight too fast or too slow. And then in his case, we added some calcium gluconate supplementation since he couldn't be on a high potency diet right away. And just because those bones looked really, really ghostly. So that was in January that we saw Boomer. And I want you guys to check this out. So there's January, May, and November. And what I want you to look at is just with weight loss alone, check out the difference in this bird's respiratory capacity, what we see as far as how much air sac space he has. Let's look at his overall, like all of these places, like over the dorsal aspect of his body, up over his tail. We can also see, like, look at, like now in November, he's got a caudal thoracic air sac. Holy crap, he has a abdominal air sac. He went from 120 grams to 108 to 96. 96 is his happy, healthy weight. This lipoma is going to take more time to decrease, but really, he's done a fabulous job. So where's Boomer now? And literally, we just saw him. He's bright and alert at home. He's foraging for his food. He's able to fly and move around without any significant respiratory effort. Back in January, he could not fly. He would just fall out of his cage. Um, he just molted. The keratin on his beak looks so much better. He just molted. New feathers are coming in that look really nice and normal. And I was so bummed. I asked my resident if she took a picture of him the other day because we just saw him last week and she didn't. So I'll have to add that in my email, but to you guys. But ultimately, Boomer's doing really, really, really well. And so recognizing obesity in birds is super, super important. And I hope that you'll remember Boomer throughout the rest of your career because you're going to see this all the time and you can make such a happy, big difference for them. All right, last one. This is Meredith. This is your 1030. Okay, we're going to look at this again. She is a 2-month-old little pullet, which just means she's a young chicken. Look at this one more time. What do you guys see? Let's put that in the chat. What do you guys notice about, yep, she's limping, she's walking, yep, awesome. Wonky feet. Tell me more about what you're seeing with her feet. What's going on with them? Curled feet. Ooh, I love that, curled feet. Okay. All right, so what are your differentials right now? What do you guys think is going on here? Vitamin deficiency, hypocalcemia, Merrick's. Okay, all very reasonable differentials. Bumblefoot, okay. Mineral and vitamin deficiency, awesome. Okay, so I love this. These are all the things that you should be thinking about. I'm really, really happy. So with Meredith, what's going on with her? I want you guys to know about this syndrome. It's called curly toe syndrome. It's a B vitamin deficiency. It specifically makes their feet turn inward and they become ataxic. This is only in very, very young pullets that you're going to see this, okay? So if they're like 5, 6 months of age, then this is not going to be a differential anymore. Also, it's often common in birds who do not get a commercial starter diet, okay? So, with that being said, diet history is really important regardless of what species you're working with. And Curly-Tooth syndrome is cool because you give them like 0.5 to 1 ml of B complex sub Q and you get them on the right diet and they literally start to walk better within 3 to 7 days. And then they just, from there, they continue to get better and better. So, a week after her B complex injection, check out how she's placing her feet. See that? That foot is not curled anymore. And that's huge. That's huge. So these birds get better quickly, and you can make a big difference in their lives. I mean, ultimately, you think about it, and we're all thinking Merrick's, we're thinking, oh my gosh, you need, you know, you've got varus and valgus malformations, and you need derotation surgeries. And no, they just needed a little bit of B complex and the right diet. So this is something that, you know, when you see a young chicken that isn't able to walk, before you go down the Merrick's road, give them a B complex injection. I would see this about once a month, but I would also see a ton of chickens. So, depending on the volume, this was a big deal. She was she was sitting on her hocks and she had some sores. And so that's why the owner wrapped her feet like that. I wouldn't necessarily recommend it. But yeah, once they're on the right diet, they're good to go and they don't have any other issues. So, just a quick thing about chickens and their life stages and the diets that they need, okay? You want to have them on a starter less than 6 weeks of age. You need to have them on a grower from 6 to 5 months old. Technically, around 5 months is when they should start laying, in which case you'd need to have them on a layer. The biggest difference between grower and layer is the calcium to phosphorus ratio, okay? You want to have them on that layer diet because it has a 2-to-1 ratio calcium to phosphorus. If you don't, they will lay soft-shelled eggs and they will have a lot of trouble with oviposition or egg laying. There aren't specific geriatric diets, but when you're working with older hens, you want to be careful that you monitor their body condition, that they're not too heavy. These ladies are going to get arthritis. We want to be careful to make sure that they're able to get all of the calcium they need. So if they are going to lay, they have those nice firmly shelled eggs. So it's not that there's a special diet for them, but you want to put a little extra thought into making sure they have everything that they need. Okay. I have a question for you guys, and this is the last one. What leafy green contains oxalates that ultimately bind calcium? Yeah, spinach. I love it. I love it. Yep, spinach. Great. Okay. So I love that you guys know that. Super important. If you feed a laying bird a ton of spinach, they will lay soft-shelled eggs. So, when you tell somebody, oh, feed leafy greens, make sure that you give them the caveat about spinach. Y'all are great. I love this so much. Okay. Who thinks that parrots should choose what they eat? Like just that they can choose their own thing, that they ultimately will choose a balanced diet. Oh my gosh, I love you guys. Okay, they are silly gooses. So many clients will come in and say, why do I need to do all of these things that you're telling me? They're birds. In the wild, they would choose a balanced diet. Well, studies have shown that in captivities, parrots will choose junk food, just like us. So ultimately, it is very important. And when you get this question in practice, you can confidently tell people, no, they do not have that behavior like they do in the wild. There are papers that prove it. So that's it. I hope that you guys, I know it was short. I hope that you guys learned some things. I hope when you go into practice and you see these different types of presentations that you go, oh my gosh, I had this great Sunday evening conversation with Dr. Murphy and Harrison's, and you'll remember all the things to do. So if you have any questions, I'm happy to answer.